or representation 2, antimicrobial susceptibility of pathogenic Leptospira species from human leptospirosis in Sri Lanka. The authors are Dr. Tilini ABDI, Dr. Roshan N, Dr. De Silva S, Dr. Rajapaksha S, Dr. Karuna Nayaka P. The presenting author will be Dr. Lilani Karuna Nayaka.
Good morning, everyone. My presentation is on antimicrobial susceptibility of pathogenic Leptospira species from human leptospirosis in Sri Lanka. Leptospirosis is a potentially fatal acute febrile illness with an extremely broad clinical spectrum ranging from mild to severe disease. Emergence of new clinical entities such as severe pulmonary hemorrhagic syndrome and myocarditis have increased fatalities in recent times. Antimicrobial treatment has shown quicker resolution of symptoms and reduction of the likelihood of progression to severe disease in some cases. Antimicrobial susceptibility studies in Leptospira has been done by some countries, and most of these studies are from animal isolate. With the growing antimicrobial resistance to other bacteria and the use of doxycycline as prophylaxis in Sri Lanka, knowing the antimicrobial susceptibilities in Leptospira strains is important to select empiric therapy. So our objective was to determine the antimicrobial susceptibility of penicillin, cefotaxime, ceftriaxone, doxycycline, ciprofloxacin, and azithromycin in Leptospira isolates for human leptospirosis. Ethics was obtained from Ethics Review Committee Medical Research Institute. This study was carried out at the National Reference Laboratory for Leptospirosis Medical Research Institute. We collected Leptospira isolates from blood of patients from 2012 to 2019. Broth microdilation assay was performed according to the protocol reported by Murray and Hospital in 2004. Each 96-well plate included serial two-fold dilutions of the 6 antimicrobials mentioned earlier in EMJH medium. Antimicrobial solutions were prepared as recommended by clinical and laboratory standard institute. Final antimicrobial concentrations range from 0.006 to 25 micrograms per ml, and units per ml was used in penicillin. 7-day-old Leptospira inoculum were added to wells and incubated at 30 centigrade with positive and negative controls. All tests were performed in duplicate, and tests were repeated if the results of the duplicate test runs did not match. Leptospira interrogans, pyrogenes, and ATCC standard cultures were used for internal quality control. This image shows broth microdilation assay we performed for Leptospira species. After incubation, disassuring blue color dye, which is oxidation reduction indicator, was added on the 3rd day. And we further incubated, and the MICs were recorded on the 5th day. The last well with blue color, that is no color change, was recorded as the lowest antimicrobial concentration. And you can see the positive control, we used antibiotic-free medium, and the negative control, we used only medium. Results, microbiological identification, we analyzed 23 clinical isolates, and among them, 6 were new pathogenic Leptospira genotypes isolated first from Sri Lanka. All isolates belong to 3 genome species, and majority were interrogants, 1 each from Leptospira bob-petersoni and Leptospira kirschneri. Among them, 5 serogroups, there were 5 serogroups, and majority of them belongs to pyrogenes. Demographics and clinical details of the patients. Their median age was 39 years, ranging from 12 to 72. Male predominance, males were predominant, and majority of these patients were from Western province, and 6 from Southern province, 1 each from Northwestern and Over provinces. Among them, 8 patients were with severe disease. And most common complication was acute injury in these patients, and other complications noted was leptospirosis, pulmonary hemorrhage, myocarditis, and septic shock. This table compares the antimicrobial susceptibility results for Leptospira isolates. In a study in Indian isolates, and rest they thought had collected 10 Leptospira human isolate from Egypt, Thailand and Hawaii. As you could see, the MIC50 of these of our strains were low for beta-lactams and ciprofloxacin. But doxycycline is given MIC, the highest MIC was from doxycycline, that is 1.5, similar to the Indian isolate. And some of the doxycycline strains, our strains, had 25 or more than 25 micrograms per milliliter, showing highly resistant strains, and most of them were from Western province. As you could see, azithromycin had a very low MIC 0.05, and about 74% of our strains had very low MICs, that is less than or equal to 0.1 microgram per ml. There were no significant difference found among strains of mild and severe disease. So in conclusion, beta-lactams, penicillin, cefotaxime, ceftriaxone, and ciprofloxacin have shown good in vitro activity against all Leptospira strains, and cefotaxime showed the best MICs among the beta-lactams. Azithromycin had shown promising in vitro efficacy, with majority of our strains having very low MIC. Doxycycline had the highest MIC 50 with many highly resistant strains, indicating its limited ubiquity in our patients, especially in the Western province. These are my references.
Okay, thank you, madam. Now it's time for the questions and answers.
Sam, can you hear me?
Yes.
You can ask a question.
Yeah. Yes, I have a question.
Yeah.
I have a question.
Yes.
In the samples collected were spreading over a number of years, I understand.
Yes.
Yes. I mean, how do you actually, the actual accuracy of those samples and the clinical details and those things of those?
Actually, we maintain our biorepository at the National Reference Laboratory, and we have all the details.
Hello,
Yes.
Can you hear me?
Yes, I can hear you.
Yes. Yes.
We have all the socio-demographic details, and we have done in 2 sets actually. The last set done was in 2019. We didn't collect the samples and did at once, but we did it in 2017 and also in 2019.
Right. Thank you.
Okay. Now, in your study, you showed that doxycycline MIC was fairly high. So do you recommend it for prophylaxis in the future, or do you recommend something like azithromycin?
So actually, the high strains we saw from Western province. Now in Southern province, we had only one strain that is over 25. So I can't say I don't recommend, but if you are giving the doxycycline, they have to monitor the doxycycline prophylaxis, whether they are taking it correctly and all, and also to do these type of studies to show that there is an increase in doxycycline. But azithromycin, I don't recommend for prophylaxis.
Okay. Now, recently they have shown some pulmonary hemorrhage appears to be more common in some patients. Did your study show that certain strains predisposed to pulmonary hemorrhage, complication of pulmonary hemorrhage?
So there are no specific strains. Most of these, like pyrogens, was the common strain that we have seen in this cohort. But other strains also can give rise to pulmonary hemorrhage. There's echo here.
Yeah, that's like echo, yeah.
Because in other countries, they have shown different type of strains that cause pulmonary hemorrhage.
Okay, now,
Yes, that is the time allocated for the second presentation. Thank you, Dr.